To begin with, for some of you may have already watched this talk or been part of one of these discussions with colleagues, with friends, with family, with somebody at the Neurodiversity Center. But a beginning point is to understand neurodevelopmental conditions such as the autisms so seldomly occur on their own. Although textbooks and descriptions like to create the impression for us that the lines between diagnostic classifications are clear and precise, in real clinical terms, this is not the case. Now, when we begin to talk, we need to understand when we talk about the autisms, it is far more responsible to remember that there is very often an overlap of conditions or symptoms. The fact that an individual almost never presents just with an autism condition is often not known to people and is often misunderstood, which means that all the individual's difficulties aren't understood. Neurodevelopmental problems are almost always genetic. And in these neurodevelopmental problems, the neural system of the child is impacted. Therefore, the person's brain develops differently. Around 2010 and 2011, Christopher Gilberg and his team coined the term ESSENCE, or the acronym ESSENCE, to refer to early symptomatic syndromes or early symptomatic signs eliciting neurodevelopmental clinical examinations. And in essence, what Christopher Gilberg was describing is all of those signs that lead one to going to a professional, a psychologist, an OT, an SLT, a pediatrician, one of these professionals, a psychiatrist. Now, children and their parents may present in clinical settings with impairing problems before the age of 3. The difficulties may be in any of these areas, in their general development, in their communication, in their social interrelatedness, in their motor coordination, in their attention, in their general levels of activity, in their behavior and their regulation of emotion, in their mood, and even in their sleep or their eating or other areas of self-care. But problems in these areas are often very well masked, especially in our girls. Just very quickly, and again, I apologize for those who have already been exposed to this slide, but these neurodevelopmental or ESSENCE conditions include the autisms, ADHD, what we refer to as oppositional defiant disorders, specific learning disabilities, reactive attachment disorders, intellectual developmental disability disorders, avoidant restrictive food intake disorders, tic disorders, behavioral phenotype syndromes like fetal alcohol syndrome, and epilepsy syndromes. I race through this list because the important factor is to understand that categorical presentation in one diagnostic area in children, when it comes to neurodevelopmental problems, is very rare.